Hello, everyone. Thank you for coming. We're just going to give people a couple of minutes to get in. Please feel free to say hello in the chat if you are comfortable to say where you are, maybe, or the union you're in. But you're very welcome. Thank you for signing up for this webinar, and we'll get started very shortly. The webinar is scheduled to finish at 8:30, and we will be keeping to that time. So if you're wondering how long the webinar is going to be, we're going to start very shortly in the next couple of minutes, and then we will hear from our speakers, and there will be hopefully time for Q&A. So if you have got any questions, we would ask you to put the questions into the Q&A function, which should be in your menu bar. We won't be taking questions from the chat. So if people put questions in the chat, we'll probably just put a reminder in the chat to find the Q&A function, and then we'll be taking questions from there. So I think we're getting filled up nicely. I'll just give people another minute or so to come in. But everybody's just finishing off their tea quickly. Okay. Thanks for, it's nice to see all the people saying hi in the chat. Do feel free to say hi. This is also obviously an opportunity for women who are in the same unions, who maybe don't know they're in the same union, to find another sister, either in their region or in their union. So do feel free to introduce yourself in the chat. And then we'll get started. I'm just going to give people another 30 seconds, and then we're going to get started. Welcome. If you're just joining, we're going to get started in about 15, 20 seconds. And just a reminder that if you have got a question, if you pop it in the Q&A function, we'll do our best to answer it. We'll get it answered. And if we don't get it to it tonight, we'll still make a note of the questions, and we'll find a way to get that information out to you, either in a newsletter or in on the website. A reminder, if you're not a member of the FiLiA Trade Union Women's Network, to join. There'll be links in the chat you can copy and access various information, resources, so on. So please make use of those links, and get involved, get active. Okay, I'm going to start because we said 7 o'clock, and I do want to finish at 8:30. So I just want to thank everybody who's taken the time to come tonight and to be here for this webinar. We're having this webinar about a month ahead of an event in the trade union calendar, which is International Workers' Memorial Day, which is all about commemorating those who have suffered through the failures of health and safety at work, but also fighting for better health and safety conditions at work. I'm Kiri Tunks, and I'm currently one of the women who helps convene the FiLiA Trade Union Women's Network. Just a quick bit of information about the FiLiA Trade Union Women's Network. We've set this up to do a few things. I'm just going to give you a brief summary, but essentially what we're trying to do is bring women together in unions and also in regional and national networks. We want to build women's power in the union movement. We want to break down obstacles to involvement, which can be many. We want to challenge the sexism and misogyny rather in the movement, and also to share information and knowledge. And we're very hopeful that tonight's webinar will help with some of or all of those things in some small way. So we hope that you'll find it useful ahead of that, or maybe that you will then go away and organise in your workplace to do some actions and events around International Workers' Memorial Day, which is on the 28th of April. I've already encouraged you to join the FiLiA Trade Union Women's Network if you haven't. And the link, like I say, will be in the chat. We've got 3 really brilliant speakers. I'll say more about them as I introduce them, but just briefly, we have Jenkins from the Scottish Hazards campaign. We have Perdy Patterson, who's a health and safety workplace rep. And we have Susan Aitouaziz, who is a health and safety trade union activist in London. Obviously, health and safety is a huge subject. So this is just a primer, an introduction. We hope you'll leave a little bit more informed, and we hope that you'll be willing to take up the health and safety questions in your workplace. As I said earlier, International Worker Memorial Day is an annual commemoration of those who have died due to unsafe workplaces, and a way of demanding better health and safety in our workplaces going forward. Now, this kind of discussion is obviously vital, but it can also be upsetting. It is fair to just let people know. Health and safety failures do result in injury, trauma, and unfortunately death. And our speakers may well be sharing things that may be hard to hear. We hope that by coming together in this way, we will be more informed and that we can actually work together to improve things. We'll also be posting links in the chat with more information and also places that you can get support and advice for any relating to any of the issues or things that you may hear this evening. I've mentioned about the chat being kept open. Obviously, we're going to keep that civil and respectful. I wouldn't expect anything else. We'll share links there, but we'll also send out an email following up with those links as well, so that if you don't manage to get them from the chat tonight, don't worry, we will collect everything from the chat and put them in a document and send them out to you as part of a follow-up email. If you've got any questions, again, please do put them in the Q&A function, not in the chat. And we will be aiming to finish by 8:30. So I hope that's okay, and I hope everybody can just stay for that long. So it's really my great pleasure to introduce our first speaker, who is Jenkins from Scottish Hazards. Kathy has been involved in workplace health, occupational health and safety since 1993, both professionally through public health, health promotion and university teaching, and through active involvement in the trade union movement. She is the trustee and secretary of Scottish Hazards, which works for improved working conditions in Scotland and worldwide, and provides a health and safety information, advice, support and representation service to mainly non-unionised individual workers and groups of workers, while at the same time always urging them to join a union. Scottish Hazards works closely with the STUC, that's the Scottish Trade Union Congress, and individual Scottish unions, is part of the UK Hazards Network, and is in touch with other international grassroots campaigns. Thank you very much, Kathy, for being here this evening, and we're really looking forward to hearing what you've got to say.
Thank you very much. I've done some slides, so I will share them now, and hopefully that will work. Assuming that people can. So I'm Jenkins, as people have said, and I work with Scottish Hazards, but I want to emphasize that we are part of the UK-wide hazards campaign. So what I'm going to be saying tonight is really mostly about the whole of the UK. I want to emphasize that health and safety is really an international issue. I mean, you'll know that. But as pointed out by the fact that more than 70 countries recognize and mark International Workers' Memorial Day, which is partly what we're talking about today. And I also just want to emphasize how big an issue it is. The International Labour Organization reports that nearly 3 million people throughout the world die each year through work. And that is about 3 times as many as die through war. Now, I'm not trying to make an equivalence at all. All I'm saying is health and safety is a major health issue for the world. Just coming down to UK level, this is information pulled together by the Hazards Campaign at UK level. This slide is about incidents, and I would underline incidents rather than accidents, because we believe that most accidents can be prevented, so we call them incidents. And this reports incidents of people killed at work through incidents on the railways, in the sea, at work, through suicides on the roads, etc. There's a lot of information in this. You will be getting the slides, so please don't feel you've got to take it all in right now. This is another slide that shows the number of people who die each year from occupational disease. So heart disease, respiratory illness, cancers, all caused through work. And this another slide that is about the numbers of people we estimate are suffering from work-related illness. Now, this is like 3 times what the HSE, the Health and Safety Executive, estimate, but we believe these numbers are probably closer to the truth. And that was the bad news. The good news is that the trade union effect. Unionized workplaces are safer. This is a fact that's recognized even by governments. The evidence is that unionized workplaces are between 25 and 50% safer than non-unionized ones. And this is because that's why the work of safety reps is so important day in, day out. And I would also add trade union equality reps to that. So we will be hearing from trade reps and activists later. The 3 pillars of health and safety regulation in the UK are the employer, who has the responsibility under the law to look after the health, safety, and welfare of its workers. Worker representation and consultation, I've talked about that, really important that the trade unions are involved, and state regulation and regulatory inspection. The Health and Safety at Work Act is the fundamental health and safety act in UK. It's an enabling legislation so that regulations can be made under it. It's very broad in itself. What it says about employers is it shall be the duty of every employer to ensure, so far as is reasonably practical, health, safety, and welfare at work of all his, I would underline, employees. Hopefully more new legislation is better drafted. We disagree with the so far as is reasonably practicable, because that gives the employer the chance to say, oh, well, it's going to cost too much or whatever. In Europe, quite a few countries don't put that in. And employees' duties, it shall be the duty of every employee to look after themselves and their workmates. And the enforcement is through the Health and Safety Executive and Local Authority Environmental Health, plus other enforcers for specific sectors like air, sea, and rail. An important set of regulations under this enabling act is the Safety Reps and Safety Committees Regulations 1977, or what's called the Brune Book. It gives fairly extensive rights to trade union health and safety reps. And this is what enables health and safety reps to really take action in the workplace and look after workers. Other regulations that have come in under the Health and Safety at Work Act are, they're quite a lot, but these ones that I've listed here came out of EU directives. So when we joined the EU, we had to adopt directives on health and safety. Now, of course, we've left. These are under threat. And they're important, like the management of health and safety at work regulations is the one that says the employers have to do risk assessments. And workplace welfare regulations say you have to have rest areas, ventilation, etc. And just a little sign of what's happening is this was from the hazards campaign. The HSE is now proposing removing obligations that are under the chemicals regulations that were from the EU. And we've already diverged in around 15% of cases. So it's worrying. The other thing that's worrying is the Health and Safety Executive, which is the main enforcer. This slide will show you how much the resources have been dropped since 2010, and that continued up until when the Labour government was elected, and they haven't actually reversed that trend, or at least they haven't put it back in. And the second part of it shows the reducing numbers of inspectors. The other problem that we think about with the Health and Safety Executive is it was set up to be an independent enforcement body, and it's really no longer independent. The trade union element of it has dropped a lot. I can't say more, but it's a worrying trend. So the second piece of information is the TUC Biennial Health and Safety Representative Survey that's done every 2 years. And I just want to give you a snapshot of what it found. And you can see stress is the high runner from all the reps that report. stress, workload, bullying, harassment, violence, and verbal abuse, a huge amount of stress-related issues. Also other ones, of course, slips, trips, falls, which is a huge one, high temperature. So it's not that it's just stress, but most frequently cited concerns related to psychological risk. And this is more information which I can't go through, but you'll have it on the slides. And again, the law says that employers should assess risk from all hazards, and that includes hazards that might cause stress. But quite a lot of them don't, and some of them don't tell their employees that they have done it. This is a slide I used for a European Work Hazards Conference, and I wanted to use it just to emphasize that stress and struggle, because it's our struggle. We have to deal with stress. We have to make sure it's reduced in the workplace. We have to put pressure on employers and the enforcers to take it more seriously than they do. And just to underline the importance, not only does stress create mental health issues and emotional issues, but it also has physical health links. And this is some research that was done that showed that 23% increase in heart attacks and deaths from coronary heart disease throughout Europe from work strain or stress. To tackle stress, we need to look at the environment in the workplace, the work task, individuals, and the work organization. These are some of the causes. I can't go through them all. You'll know a lot of them from your own work, and you know, some of you will be reps, and you'll know the HSE looks at 6 elements when they look at stress risk assessment: demand, control, support, relationships, role, and change. And I just love this cartoon, so I put it in. Long hours and too much pressure are not good for you, because workload is such a big issue. And I love this one too, because this is what we should be aiming for, to have more time at home with our families and not be stressed at work. Coming to women, this is from the Industrial Global Union, and it's just taking another international view. So they're saying that 5 ways to transform women's experience of the workplace. The same is not equality. So treating men and women the same is not equality, because they're different, and because we have different bodies. Personal protective equipment should be designed for the person who's wearing it. I think it's been in the last decade that police women, for example, got flak jackets that actually fit them. So equal treatment is not equal outcomes. Count the work that nobody counts. And this is about the fact that women still, even in this country, do carry a bigger burden of domestic work and caring work. And the Industrial Global Union estimates that in the world, 76% of that work is done by women. Close the pay gap, we all know about that. Change the institution, not just the rules. So not just making a policy change, but actually trying to change the culture. And the last one is know your rights and defend them. And that's what we're here about really today. Coming to just, this is not comprehensive at all, but it's some of the issues that women face in the workplace that are, if not unique to them, are worse for them. I can't go through them all, but inappropriate PPE and work tasks mostly designed for men, I've said, greater exposure to repetitive and monotonous work, low pay and precarious contracts, the double burden I also talked about, sexual harassment and violence and aggression. And this is in work, but also outside of work, because if you're subject to violence and aggression or domestic abuse outside of work, that will impact on work. And a note about AI, that is the higher threat to clerical and admin roles, of which women make up 86%. So that's a new one. Well, maybe not new, but potential hazards during pregnancy are not always recognized, e.g. lifting and handling, exposure to chemicals. There is a legal requirement for an individual risk assessment to be done if you're pregnant. It's not always done. The EHRC report that 11% of women are sacked because they're pregnant, and 1 in 5 are subject to harassment from management. And there are specific risks for older women, including health issues relating to the menopause. And I want to point out that this can be seen as a disability under the 2010 Equality Act. So you can ask for reasonable adjustments. And then there's intersectional risks, women who are disabled, racial minorities, LGBTQ plus women, Muslim women and other women of faith, refugee women, younger women, older women are all more at risk. And I've just put this in because who is flexibility for? I mean, flexible work should be at the heart of what we're talking about, and it's usually flexing in the way of the employer, not the employee. And I just want to highlight, I can't go through all of this, but I want to tell you about the End Not Defend Sexual Harassment campaign, which is a cross-union campaign. And this is some information that comes from that campaign about the millions of workers that are sexually harassed at work. And again, the intersectionality of that and some of the risk factors. We've talked about precarious contracts, not knowing your rights. So a lot of these are key reasons for or hazards that lead to sexual harassment. What we want, and this I would underline that first one, because the Health and Safety Executive, if you can believe this, does not see sexual harassment in the workplace as a health and safety issue. So one of the things we absolutely have to change is that they have to enforce against sexual harassment in the workplace. There's other things here, and I can't go through them all, but you can see the slides, and the End Not Defend Sexual Harassment has a website that you can look at. And what safety reps can do, put harassment on committee agendas, push for risk assessments, conduct worker-led mapping. Mapping is when you look at the whole workplace and you map where there might be particular risk, demand preventative controls, and build worker confidence. And just to finish, I wanted to say about International Workers' Memorial Day. I know that we're talking about it today. These are some slides of events that we've had in Edinburgh, in Scotland, and these are some of the posters that have been done by the Hazards magazine, which is our Bible for hazards in Scotland, in the UK. I hope I've kept to time. Thank you.
Very efficiently done, Kathy. Thank you very, very much. And as Kathy said, those slides will be available. We'll make sure we send out those slides to you because there's obviously some really good information there. And it may well be that depending on your workplace, one of the actions you might take forward in the next month or so and into the future is organising a meeting with other members of your union or other people that you work with, and actually using those slides to demonstrate the importance of health and safety at work. I think it's really clear, isn't it, what a key issue or range of issues this is for everybody, but particularly for women. And we do know that health and safety issues affect women like they affect anybody, but there are also specific ways that health and safety impacts on women, or specific health and safety issues that women have to cope with that men don't. So, I mean, I hope we're beginning to convince you that health and safety is a really, really vital thing to take on at work, and also to encourage you to be someone that takes that up and gets other people to take action too. I think Kathy's already given us a couple of really good examples of how we can take action. On that last slide there was a list of specific actions that you could do in your workplace to make change or to start to win change where you are. But I'm also rather taken with the suggestion, with the failure of the Health and Safety Executive to categorise sexual harassment as a health and safety issue. That perhaps there's a potential there for a bigger campaign, something to think about maybe going forward. So thank you, Kathy. That was a lot of very detailed information, and you explained it really, really well. And it's good to have that overview. Very grateful to you. And that set of slides, we will be sharing that with you. We're now going to move on to our second speaker. Our second speaker is Perdy Patterson. And I'm really pleased to have Perdy here because Perdy is a workplace health and safety rep. And so Perdy is somebody who actually has taken on this function in her workplace to try and improve the health and safety of the workers where she is. She is a UCU health and safety rep in FE College. And she's going to talk a bit about what the role entails. hopefully that some of you listening will think, actually, that's a great role. I want to take that on. She's going to talk about how it works and also some of the issues that she's actually tackled as a health and safety rep in her workplace. Thank you very much, Perdy. Over to you.
Hiya. Yeah, so working in a college, the first thing I thought I might mention was going back to the pandemic in January 2021 on the 4th of Jan. We were facing, I don't know if everyone can remember, but there was a huge rise in COVID deaths at that time. And obviously, working in a college that was a hub for all kinds of different adults in different walks of life. As staff, we were concerned not only for our own safety, but we didn't want to be a hub for super spreading of the virus. And it came to the point where on a Saturday night, before being supposed to be going back to the workplace on the Monday morning, we hosted, I chaired a union meeting Zoom of over 100 people, and we had a unanimous ballot to strike if we were forced to be back in the workplace. And we stayed working from home until April in my department at the end of it. So that was a sort of thing at the macro scale, and then at the micro end of things, another thing was just organising to get negotiating to get a proper decent lunchroom where people can sit and have their sandwiches at lunchtime or heat their meals. We didn't have a room to eat our lunch in other than the main canteen where all the students were. So that meant that in the brief time that you have to maybe chat to a friend at work and offload a bit and, a bit of downtime, you'd be constantly greeted by students or maybe asked for help sorting out their bursary or their enrollment problem. And, it feels bad to complain about those things or to be negative about those things. And there was a quite sanctimonious comments from one senior manager about how she sort of prided herself on sort of being a woman of the people, mixing in the canteen at lunch break and greeting people. And that makes you feel pretty bad, but the legislation says that you are entitled, if you regularly eat meals at work, to a suitable and sufficient rest space where you can warm your food. And once we really started sort of emphasizing that, hey presto, they found a room for us and put in a fridge and a microwave and some chairs and tables, and that sort of seemed like a miracle, really. And then I wanted to say something about what went into those two little examples at the sort of micro and macro end. And balloting to strike, you've got a lot of work that goes into that in building up bonds of trust and solidarity. And ultimately, if you can have that power, you're in a much better position to negotiate for what you need and to stand up for yourselves. And then at the other end, just with asking for a lunch table, if you're sort of being shamed into being embarrassed to ask for what you need, or you feel bad about being tired in your lunch break, and it's quite validating to know that, to have training and to know that there is law that says, yes, it is okay to want to have a break in your lunch break, and it's not wrong not to want to be sort of half doing your job at the same time. So that was a couple of things. And Kathy talked about stress and workload, which is obviously which I think this year, the Health and Safety Executive and the TUC alike are sort of starting to acknowledge that those are massive things. One of the challenges in being a health and safety rep is that you have the right to attend management meetings where you have a sort of equal power with the managers who can get things done, and to make representations on behalf of your members. And those meetings can be very much taken up with the sort of more obvious safety stuff that's all about fire extinguishers and broken locks and that sort of thing. And they never really do address workload and stress. So one of our campaigns at the moment is just to get that as a standing item and review the terms of reference of that Health and Safety Committee so that it's taken seriously. And there's also quite an innovative approach in my union where we've got a campaign at the moment about using our rights to carry out workplace inspections, to do workplace inspections more in the form of qualitative interviews where people can explain what the workload problems are that they have, and you can actually provide that in your report when you ask for remedial action. And if you're asking for remedial action in that sort of context, the employer has a duty to agree with you what remedial action can be taken, or at least to explain in writing why they can't do it and why you couldn't agree. within a certain period of time. So it just makes you feel a bit more empowered when you know about those things. A lot of the sort of day-to-day issues that come up in the creaky building where I'm working is that sort of, I mean, and you can think about, why is health and safety a women's issue? And there's a lot of obvious things to do with pregnant workers, and workplaces should maybe have a domestic violence policy as well. And you can find a lot about that on the TUC website. And Kathy said a lot of very important things there, which hopefully will be in the slide. But just little things like, I mean, I'm in my 50s, and you wouldn't believe the amount of time that we spend sort of chasing fans around and getting heating switched on and off, and windows opened and closed. Just things about heating, and where's the missing lunch table gone? So you can bring a lot of different skills to this. You can be the Rottweiler that doesn't mind standing up to problematic confrontational managers, or you can be a soft skills sort of person that everyone goes, oh, I like coming to meetings with you because you sort of look after my feelings. Or you can be someone who's very good at chasing up meeting agendas and saying, hey, this action was promised and it's weeks later now, what's being done about it? Or you can be someone who's good at analysing sickness absence statistics. Or you can be someone who's very good at making friends with all the people who manage the building where you work, and you know who you can chat up to find where the missing lunch table did go, or where the fans have got hidden and stuff like that. So there's a lot of different ways to be good at this, and sort of I think most people on here will have something to offer. So you shouldn't be put off by thinking thinking little of your own abilities. And I think that might be all I have time for, if that's all right.
That's great, Perdy. Thank you. I really enjoyed hearing that, because it just really demonstrates how you can take up that role and exert some power in your workplace. And I like the way that you outlined the different approaches to it, so that role could be you could take a specific angle in that role, or you could share that role or those responsibilities with other people in your workplace and have kind of a 3 or 4 pronged attack where somebody, you're kind of supporting each other to get those questions answered. I think it models really well, actually, how effective being a health and safety rep can be. So thank you so much for bringing that. And I'm sure when we come back to you, we'll have questions. Is there something else you wanted to add?
I didn't say it, but it came up in the chat, and I'll just quickly, you certainly are entitled to time off and training as a union rep, and that can certainly be addressed in the documents that have been supplied.
Okay, brilliant. Thank you. So what we'll do is we might come back to that in a bit more detail, am I entitled to training for a health and safety rep, because that's the other real benefit about taking on this role, is it does come with kind of recognised rights that but it's quite a lot where the obligations are on the employer to answer your questions, not on you to solve the problem. So it can be a really useful way of getting things done and making the employer take action. So I am now going to go to our third speaker. A reminder, we've got some questions that have come in already, and I think we'll come to those in a minute. But if you've got a question, please do put it in the Q&A and we will add it to our list of questions. I'm going to come to our third speaker now, who is Susan Aitouaziz. Susan is a retired primary school teacher. She's president and health and safety advisor for Barking and Dagenham NEU. She is the secretary of Barking, Dagenham and Havering Trades Union Council. Previously, school rep, health and safety rep for NEU, NUT for 35 years, and has worked in the British Library, social services and the NHS. So a really good global perspective of very different workplaces. And Susan is going to talk specifically about the work that she's done, but with a particular focus on asbestos. So Susan, are you there? Brilliant. We've lost you, Susan. Oh, there you are. That's it.
Hello. So I'm going to talk about asbestos. So asbestos is a generic name for a naturally occurring fibrous mineral. And there are several types of asbestos, commonly known as white, brown, and blue. Mining it is relatively straightforward. It's found close to the Earth's surface, predominantly in South Africa. It's lightweight, fire resistant, it has insulating properties, it's tough, resistant to rust, acid, salt, water, and frost. It cannot be eaten by vermin, and it's not eaten by insects either. It does not conduct electricity. Pretty miraculous material. Its fibres are invisible to the human eye, and it's been used for thousands of years. Exposure to asbestos fibres can lead to the development of incurable conditions, most noticeably mesothelioma and various asbestos-related cancers. It was used in a wide range of products, leading to varying levels of risk. Although the first documented asbestos-related deaths occurred a century ago, the UK government did not ban asbestos until 1999. And today, asbestos exposure causes over 5,000 deaths annually, accounting for 40% of the UK's occupational cancer cases. The UK has the highest rate of mesothelioma deaths in the world. 17% of these are women. However, new cases of mesothelioma since the 1990s have doubled in women. An increasing proportion of asbestos-related deaths now occurs among women and younger people. I want you to understand that asbestos can and has killed thousands of men and women. That using products containing asbestos or spending time in a building where asbestos is present is dangerous. Let me tell you about Helen Bone. She was diagnosed with mesothelioma in 2021, aged 38. This is what she said. You always think of asbestos as a disease from decades ago, affecting men who worked in heavy industry. So to be diagnosed in my 30s is shocking. In an effort to secure compensation for her illness, Helen's solicitors were faced with the task of finding out whether she was exposed to the deadly asbestos at her primary school or her secondary school, at the college where she studied to become a critical care practitioner, or Middlesbrough General Hospital, or the James Cook University Hospital, where she worked since she was 17. She may have been exposed at several or even all of them. Something terrible had happened to Helen and her family. Of that, there is no doubt. Britain had a particular appetite for the material known as the magic mineral. 7 million tonnes were imported into Britain between 1870 and the late 1990s. And it's present in much of our built environment, hospitals, schools, homes, public buildings. It remains in the roofs, floor tiles, insulation, garages, sheds, guttering, drain pipes, pipe legging, water tanks, windows, doors, partitions. I've found notice boards in a school made from asbestos, sheds on an allotment site nailed together with broken asbestos sheets. So this asbestos is far beyond its intended design life, and it's slowly degrading or is already being disturbed. The only safe way to deal with asbestos is to remove it. Then you have the problem of where to dispose of it. So if we knew it was dangerous, why didn't we stop mining it? As early as the 1870s, physicians had identified an aggressive and untreatable condition affecting the lining between the lungs and rib cage. In the 1950s, researchers in South Africa found multiple people suffering from the disease linked to asbestos, and in many cases, they had not been employed by the mines, but had been exposed. One young woman who worked at a laundrette where miners would take their overalls to be cleaned was found to have mesothelioma. At a conference held in New York in 1964, Molly Newhouse presented her work on the occurrence of mesothelioma among people who lived near to Cape's factory in Barking. Molly found the company were using giant fans to pump asbestos dust out of the large factory, where it landed in back gardens, onto a playground and Northbury Infant School. Unusually in Barking, women worked alongside the men in direct contact with the asbestos in the factory. Between 1913 and 1966, 10,142 people were employed at the Cape factory in Barking. They called it, I just looked back at, I started teaching in Dagenham in 1999, and I looked back at something that I wrote in my diary, and it was a description of the effects of asbestos in the borough, and I just want to read it to you. They called it the Barking cough, a tickle in the chest and a slight pain on breathing. Then within months, the sufferer was in agony, gasping for air and eventually suffocating to death. The factory was demolished in the 1960s, and the land was purchased by the council, and several, believe it or not, several flats and houses were built on it. Many of those who lived there or even visited relatives were exposed to asbestos fibres and subsequently died from asbestos-related cancers. Between 1997 and 2003, the estate was demolished, and monitoring of the ground still shows very high levels of asbestos on the surface. So, as I read more about the Cape factory, I saw a disturbing pattern. Reporters presumed the factory only employed men, but I had documents that detailed hundreds of women working at Cape. So I looked at the rates of mesothelioma in women resident in Barking and Dagenham compared to the rates elsewhere. And what I found was that Barking had the highest rates of mesothelioma deaths in the UK amongst women. So since the 1970s, there's been a small but dedicated anti-asbestos movement that's highlighted the danger of asbestos and fought for compensation for victims, and drawn attention to the risks posed by crumbling asbestos in our schools and hospitals. In these predominantly female workplaces, it became clear by the 1980s that hundreds of health and education staff were dying of asbestos-related diseases. In 2020, a retired teacher in Barking asked the Trades Council, for which I'm the secretary, if they could place a more significant memorial to all those who died because of asbestos in the borough. So this was at the time of the pandemic lockdown. So we began to raise money from our kitchen tables. We raised £14,000. I don't think anyone I asked said no. I don't think any worker I asked for free work, in effect, said no. It was quite astounding. Everyone I spoke to had known someone who died because of asbestos, and they wanted their lives to be remembered. So on International Workers' Memorial Day, on the 28th of April 2022, we unveiled a large granite stone engraved with a memorial to those who had died, but also a pledge to fight for the living. It is a beautiful stone in the middle of Barking Town Square. In the same year, the Works and Pensions Select Committee recommended a 40-year national strategy for the removal of asbestos from schools and hospitals, starting with those at the highest priority. The government rejected this. In my personal journey with asbestos, I've struggled with despair about what has happened and how people have been treated, but I've also found encouragement and hope. This is a story of harm, dishonesty, and suffering and greed. It's also one of determination and solidarity and mutual aid, and a refusal to be silent. I think I'll stop there and see if anyone has any questions. Thank you, Kiri.
Thank you, Susan. And I mean, I think, that your contribution is really shocking and stark kind of explanation of, of the whole thing around asbestos. But I think it also demonstrates the importance and the power, actually, of women's activism in this field of health and safety, because, it's the work of women like you and the others that supported you, other people that supported you, that has actually brought the truth about what was happening to women in relation to asbestos into public consciousness. Really vital work, and it struck me that both you and Perdy actually both made me think about how the struggles that we've got today are really linked to the historic struggles of our sisters that came before us. Perdy was talking about her fight in her college to have a lunch space, a healthy lunch space away from the workplace where, members of staff could get together and just relax and eat their lunch in a well-ventilated, clean environment away from stress and pressures of interacting with students or other kind of expectations of work. And actually, it struck me that that's one of the things that the match women of 1888 were fighting for when they demanded better working conditions. One of the things that they asked for was a safe lunch place away from the damaging, they were the sulfur and so on that they were working with in the factory floor. So health and safety has always been at the heart of women's struggle for decent pay, decent working conditions. And it may be that what we're fighting for now in our workplaces is slightly different or comes in different forms, or it may not. It may still be like what Susan's talking about, the impact of asbestos and so on. But really important, I think. If you haven't read Louise Raw's book on the match women's strike of 1888, it is a brilliant, inspiring story about how those women took on their employers and won. And there are plenty of other stories like that from history. And I think the fight for justice over asbestos is another one of those stories that we can add to the canon of brilliant activists fighting for justice for workers in the face of failure of health and safety rules. So thanks very much for that, Susan. As we said earlier, you may be hearing sort of things that are a bit shocking or upsetting, or the chat has got lots of links for you to get more information, more advice, more guidance, and more support if you need that. But again, we will be sending the links out to you, so don't worry if you haven't managed to get all the links from the chat. So that we've heard from our three speakers, and now is the time when we're going to open up for questions. We've had some questions have come in. And I think we're going to go to a gallery view, are we, Ms, so that we can see all the speakers at once, and different people may feel they want to answer different questions. So I'm just going to pose the first question that I've got in front of me. I don't know if Perdy's there, able to come back and join us. Brilliant. So the first question I've got, and it's about the question of stress, because I think this year the International Workers' Memorial Day theme is about stress. And I think, we've got a culture in which a lot of people think stress is just something that we have to put up with and manage. And the question basically says, how can I get my colleagues, and I guess we also mean our managers, to take the issue of stress seriously? Because I can imagine that people might think, oh, it's just me not coping, or, it's not really a workplace issue. How can we get it taken as a serious workplace issue? I don't know if anyone wants to come in first on that.
Well, I can come in and then others.
Thank you, Cassie.
Can come in. It's a difficult question because it really depends on your workplace and your colleagues and the members. I mean, I think there is a lot of information about stress in the workplace, and pulling some of that together might be useful. But I think one thing you can do is start to talk about the fact that the law says that employers should be risk assessing for stress. So in other words, there should be a look throughout the whole organization at what the causes of stress are, what can be done about them. And there is the Health and Safety Executive has a stress management standards, that have a lot of tools that you can use. So they have a survey that you can use to go to every member of the workforce, and there's an analysis tool that shows where the real problems are. Is it control? Is it demand? Is there too much demand? Is it that people don't have control over their workplace? Is it relationships? Is it role? So I would maybe start by looking at that and saying, let's develop a campaign within the workplace to ask the union and the employer, or I mean, I would argue a joint survey would be excellent, because then you've got commitment from both sides. But it's one way to start. And there, as I say, there are other good materials, slideshows, videos, etc. So if people want to come back to me, they can.
Thank you, Cassie. I don't know whether Perdy or Susan want to add anything.
Yeah, I'm one of the things I think I'd like to point out is that stress manifests itself in different ways with different people, and some people kind of go quiet and they might go off sick, but other people come into work with their stress and they make life difficult for others. And you can see this in the maybe it might be a local manager who always takes on more than they should, and then they're difficult to their employees. It's probably a good idea to familiarize yourself with the symptoms of stress, and then as a union you can conduct research to find out if people are manifesting those symptoms and present it to the employer and ask for action.
Thank you. That's really useful.
Can I just add that a very good friend of mine who sadly died from mesothelioma, he was an amazing health and safety campaigner, but he did a lot on work-related stress, and he talked about tending and befriending, and I love that. I think because of the lean, mean workforce and so much pressure on people that we've maybe lost a bit of that, but reps are part of that whole system of tending and befriending, looking after each other, asking people, how are you doing? What's going on? Can I take some of the load off you? Or can we, just that kind of thing. So I think if we remember that, it helps too.
I think that's one of the things that, you can feel very isolated at work, can't you? And I think one of the strengths of unions and collective kind of organizing is that you are not on your own. You can work with other people and use other people's strengths, skills, approaches, styles and so on, to actually come up with a collective response that will make you feel stronger. And that's really key, I think, in terms of working together with the others in your workplace. There's two questions we've got on sexual harassment. So I'm going to ask them both, and then you can decide who wants to answer them. Kathy, the second one is specifically, I think, in response to something you said about the health and safety executive. But I'll ask both the questions because I think they're good to take together. First question is, I work in a very male-dominated environment. Banter is part of the culture, but it makes me very uncomfortable. How can I get my boss to deal with it without becoming a target for my male colleagues for spoiling their fun? So that's the general question. And then, Cassie, I think there was another question that was about, let me just find it. Sorry, it's just a bit further down. I have a question about the campaign of sexual harassment being covered or not being covered by a health and safety executive. The EHRC can take enforcement action against employers for sexual harassment, and workers have greater protections under the 2025 Employment Act. Why is it important that the HSE also has responsibility? So I think that's a bit of more of a technical question for Kathy. But if we take, first of all, anybody else might have a response to that as well. If we take the question about just dealing with that issue at work, sexual banter at work that is sexual harassment in a male-dominated workplace, but actually in any workplace, how can you get people to take it seriously and not make yourself a target? Anybody want to put?
I mean, I can come back on that, but the others might want to as well.
I don't have a lot to say about this one.
Okay. Well, I think if you will remember one of the slides that I very quickly went through from the End Not Defend campaign, said let me just see if I can find it. Build worker confidence and stop retaliation. And that's exactly what you're talking about in that question, is that, you know, if you put your head above the parapet and raise this, are you going to get hassled, laughed at, discriminated against, you know, whatever. And I think I would really recommend that if people are wanting to look at the sexual harassment issue in detail, to look at the End Not Defend campaign and get in touch with them, because they've done a lot of work on how to tackle these things. And I think one of the slide I quickly showed about what reps can do, put harassment on committee agendas, make it an official thing rather than just raising it as an individual. You know, get the union to raise it in the Health and Safety Committee, say this is an issue for all of us, and push for risk assessments, conduct worker-led mapping. I mean, obviously, if you're up against a really difficult culture in the workplace, there are a lot of steps that have to be taken, but those are some of the things that are recommended. You know, look for allies. There may be male colleagues that would support you and, you know, back you up. So that's just some ideas, but I would really recommend the End Not Defend campaign, and, you know, talk to them, because they've done a huge amount of thinking about it.
Something I would maybe add there as well is that in a very sort of boys' club culture, we can come back to this issue of stress and workload, because I'm lucky enough that certainly in my particular workplace, the banter aspect isn't really a problem, but a sort of boys' club atmosphere higher up the chain is an issue, because there's a lot about being tough and presenteeism and I don't know, risk-taking attitudes to work, and that's an issue as well.
Kiri, can I?
Susan, yeah, I did see you wanted to come in. I'll just off you go.
Sorry.
No, it's good.
I was just going to say, do you know what? Use the sisters, because I've known women who've worked in workplaces where they are the only female in the workplace. And I remember one woman coming to the Women's Rights Committee at the TUC, and she didn't say anything for 5 weeks. 5 weeks, she just sat there. She didn't say anything. And she slowly gained confidence from the group. She became the rep, which gave her confidence. She went to regional meetings. She told other women at that regional meeting what was happening to her, and things began to get better in her workplace. So actually, you know what, women's groups are really important. Meeting as women, Kiri, is really important. And she talks about how hugely important it was just to be with the sisters, because no one judged, no one asked her to do anything. They just listened until she was ready to say something. And so I would really give a cheer for women's only groups. They are really essential in those situations.
Thanks, Susan. I think that's very important, actually. Sometimes just the most radical thing you can do is get a group of women in the room and just start talking with each other, because it is very empowering. And if you haven't got that collective in your workplace, you can find it somewhere else and take it back into your workplace. But get that power from your sisters where you can. Kathy, do you want to come back on the question about why it's necessary for the health and safety executive to take a position on sexual harassment, if it's, you know, because there are other powers that are available to deal with that?
Yeah, I mean, we've done quite a lot of work on this in Scotland, and I'm not the one who's mainly done it, so I'm going to not be able to give chapter and verse. But we have done freedom of information requests, and we've done looking at what the HRC has done in relation to enforcement, what the police have, because the HSE says it's not us, it's either EHRC or the police. Now, obviously, most cases don't go to the police. Most cases don't even go to in the workplace, because most women don't talk about it. So it's a real hidden issue. But when it when it does come up, the EHRC can take enforcement action, but our understanding is they don't really. What they do is they talk to employers and make agreements with them, which is important. I'm not denying that at all. You know, they say, let's look at your policies and your procedures, but that is not enforcement action. And so we're calling for the HSE to take it on and take enforcement action. They could work with the HRC. It's not that it has to be one or the other, but we haven't seen the enforcement action that we would like to see on sexual harassment. The other thing I wanted to add, which is a separate question that I didn't get a chance to say, is that the Health and Safety Executive has also pretty much refused to look at bullying and harassment as a health and safety issue, even though when you look at what the health and safety reps are saying, that's really high up on the list. And the third thing that they are sticking at, although there's a big campaign to change this, is that they won't look at work-related suicide. They won't say that this is nothing to do with us, is what they're saying. So I think and I think somebody talked about in the or you did, I think, Kiri, about in taking on the issues around the health and safety executive and everything. And I think at UK level, talk to the Hazards campaign, because they are really on that. And the Hazards magazine has done a huge amount. If you want more information, go to Hazards magazine website. They have a great database of information. So there's a lot there.
Thank you very much. Perdy, did you want to come back?
Yeah,
no.
If I've got time for just one more thing. You mentioned the on the mental health issue. There's I can't quite remember where it cropped up, but recently it may be in the new Employment Rights Act 2025. There's a comparison of regarding sort of mental health issues and stress. Employers have a tendency to locate it in the employee. It's the problem of the employee. So you can have your special counselling helpline or your mindfulness lunchtime sessions, and you can sort out your little problem. You're pathologized because you can't deal with the 70 hours of work in a 35-hour working week. And as union reps and as safety reps, we say remove the hazard in the first place. So we'd be asking for workplaces to investigate and analyze what's going wrong. And then with the with the issue of the mental health and suicide, where we had the Ruth Perry case, obviously connected with the Ofsted inspection. An interesting analogy that was drawn was that when you remove smoking from the workplace, you don't say, well, you say, well, not everyone gets lung cancer. Obviously, some people are going to be more vulnerable and some people are going to have their home issues, but that doesn't mean you don't do anything about it. And I thought that was a helpful way to look at things.
And can I just follow that up by saying it absolutely is the case that employers quite often try to blame the individual. They say or they say, oh, it's something to do with your family life or, whatever. And that's why I think the risk assessment is so important, because if you use the management standards of the Health and Safety Executive, it doesn't ask about individual. It doesn't ask, are you stressed? Are you not? It asks, how much control do you have over your work? Are you getting too much work? Do you have a good relationship with your supervisor? Do you, so it's causes, not individual factors, that are being assessed. And that's why, as a matter of fact, one of the tools that we used to use in Scotland, which was called prioritizing organizational stress. So it's prioritizing, look at the organizational causes. Doesn't mean individuals don't have individual causes, but it's the organizational ones that we want to look at through work.
That's another thing that perhaps we could take up in the Trade Union Women's Network is getting our members to carry out those assessments in their workplaces, and just becoming aware of that tool. So thank you. That's a really useful follow-up action as well. I've just seen in the chat somebody following on from what Susan said about women's groups, sisters getting together with other women for strength. Someone's put a link to a podcast, and I have to declare an interest, because I did record this podcast with a group of women. It is in a school, but they set up a women's group, and it is a nice listen. It is a really empowering listen, and obviously different workplaces you maybe organise it slightly differently. But this women's group that they set up at work has transformed the group, the school, the women themselves, and just is a really good example of that collective strength of women coming together and being there for each other and organising and supporting each other. So it's definitely worth a listen. It will brighten your day. So I've got another question, which was about what do I do if I raise a question about health and safety? I think this speaks to the risk assessment that you were just talking about, Kathy, but there may be some other pointers that we can give people as well. What do I do if I raise a question about health and safety and my manager refuses to do anything? I mean, I know we've touched on this really. I suspect people will say organise collectively, do a health and safety risk assessment. But say you've done that and your manager's just going, saying, yeah, well, later, or we haven't got the money or whatever. What would be your, if you come up against an obstacle, what would be your next step?
Well, Perdy can speak to this because she does it. I mean, the brown book that I talked about, the regulations, the safety reps and safety committees regulations, gives trade union reps the right to demand a health and safety committee. Now, it means you have to be in a unionized workplace, or at least have enough members in the workplace and you have an election for health and safety reps. If you're an elected health and safety rep and there are two of you, you can ask legally for a health and safety committee to be set up. And that has to have equal numbers of reps and employers on it. And that is a legal right. So Perdy can say more about that, because she's
actually I can't. I mean, I joined a structure that was already in place. So
okay,
as to starting it,
yeah,
I think.
But you have that right under those regulations.
Yeah.
So the problem it comes if you're just an individual person and you don't have the union behind you, and you're trying to raise a health and safety issue. It's really difficult. And again, it's about trying to get collectivity, trying to get a number of people to do it. And of course, I would say, and most of us here would probably say, unionize, get more members of the union, and then you can demand a health and safety committee, and then they have to meet with you and talk about health and safety issues.
Yeah.
I think that's what I would say.
Thank you. Anyone else? I've got one more question, which is to do with, Perdy started to answer it earlier, but I did say we'd come back to it, which is, am I entitled to time off for a health and safety role, and how do I get training? So, if someone's interested, what from here, what would their steps be? Susan, do you want to come first? You're nodding enthusiastically. I decided you had a lot to say.
Right. So if you are interested in health and safety, first of all, contact your union and tell them that you are interested in being the health and safety rep in your workplace, because the law treats health and safety reps slightly differently to normal workplace reps. And you have more protection from the law about taking time off, about what you're allowed access to, and about training. And it's also, you need to register that you're a health and safety rep with your union, because once you do that, they will offer you some training. I presume all the unions offer training to their health and safety reps. And it's brilliant training. It's actually really good. The TUC training is really good. And I would go on every course you can. They will have to let you go on those courses. You'll find that they will let you go on those courses. And the more that you learn, the more confident you will be to raise issues, which actually, Kiri, is what I did when I started talking about asbestos and no one wanted to listen. And that included my union, to be perfectly honest. And so I actually went on every piece of training I possibly could and just kept going at it. and just kept saying, just going. But, contact your union, and we really need more health and safety reps in the workplace. I find that, I worked in schools, as you know, and quite often we don't have health and safety reps in schools. We'll have a rep, but we don't have a health and safety rep. And I think we need both, actually. So definitely encourage people to take up the role. And it does give you confidence. The knowledge that you gain actually does give you confidence to go and talk to managers and actually say, actually, you do have to do this because it's the law, and I know a little bit more about this than you do. So, and within schools, I would then go to my local authority and say, they're not moving on this, so, but I would be persistent and definitely take up the role.
Thank you, Susan. Perdy.
I would add to that as well that we talked about the power that you get from being in a space with your sisters, and I would also say that you then need to take that power into the room where it happens. If the power is located on a health and safety committee that's staffed by a lot of people who are not very sympathetic, what I'm trying to say is that the rights that come with that role are not necessarily found in other places. So, for example, on the health and safety committee at my institution, with workload being an issue at the moment, they're sort of saying, well, we have this other committee that's dealing with workload. Now, the problem there is that committee doesn't have a duty to take action or to sort out the problem. That issue needs to come into the health and safety committee, because in that forum we have the right to ask for action, and they have a duty to take action.
Thank you.
Absolutely. And can I just add to that one thing to say, what Susan said, is that you need to be elected as a health and safety rep, but quite often, sadly, there isn't a lot of competition.
Yeah.
But we do really need, just like Susan said, if you look at the TUC reps survey that I talked about, which you can see online on the TUC website, the age of health and safety reps is getting older and older. And so there's a real issue about recruiting new safety reps so that we can keep this work going. The other thing is that the Brown Book, the regulations, the 1977 safety reps, safety committees regulations are very specific about what a health and safety committee has to be. And the regulations say you have to have equal representation of workers and of reps and employers. Now, what happens is, what we get reported anyway, is that employers set up health and safety committees and there's like one rep, and all the rest are managers. And that puts the rep in an impossible position because they don't have that kind of power. So in that case, what you need to do is argue for a health and safety committee under the 1977 regulations. So it has to be a specific health and safety committee set up through those regulations. And then you can argue for your equal numbers.
It sounds like what we need is women to get a bit of training, a bit of knowledge, but then once you get that bit of knowledge, that's going to give you an awful lot of power to actually make real change. Yeah, that's very useful. I've got one last question. I have to say, all our speakers have been so brilliant tonight in your answers and in your presentations. You kept to time and so on, that we're ahead of time, but so I think I've got one last question. I haven't got any other questions in the chat, and in the interest of health and safety, I think we may finish a few minutes earlier than we planned. But I have got one last question, which is one of those questions. If there was one thing that you would say to a woman here tonight that she could do tomorrow or this week, that she could go in and it would start improving health and safety in her workplace. The first step, what would you do? What could someone just do? A first small step tomorrow that would start on that road down to improving the health and safety in her workplace. I'm going to give you a couple of seconds to have a little think about that, because that might have been a bit left bit left field. And it may be that you want to repeat something that you've already said, but yeah, just one thing.
I'll just jump in straight away while Susan and Kathy are maybe thinking about it. But I would sort of say, do the kind of maybe boring but maybe not scary thing of looking at your organizational structure and understanding who has responsibility for health and safety. Is there a group director of health and safety? Is there already a health and safety committee? If so, are there reps who are already on that? Is your organization in any way unionized? And you don't just find out who has responsibility for all that stuff. And if I'm allowed to have two instead of just one, I would say just talk to your colleagues and ask them what would improve our working conditions here, including workload and well-being and welfare and stress, you know.
Thank you, Perdy. Susan, have you got something? You're on mute. Sorry,
yeah. Do you know, one of the first things I did, because I was quite young and a little bit nervous about saying anything or doing anything in the workplace, is I put a poster up and I put it in the women's toilets. And that was my first sort of act, was to put this poster up. And then when I walked in the staff room, the women said, "Have you seen that poster? Absolutely spot on, absolutely right. That post, did management put that there?" And I said, "Oh, actually, I did. I put it there." And I think, you know, it's you don't even, I think that would be one thing to do. The unions have masses of posters. Get a poster, put it on the notice board, put it in the toilet, and someone will agree with it and say, "Who put that there?" And I think that was the one thing I did when I was nervous about doing anything at all, is I put a poster up.
Thank you. That's a really smart idea as well. Thank you. Kathy, have you got anything that you would suggest?
I was going to say what Perdy said second, and that is keep your eyes open and talk to people. You know, look around, try to get a sense of what the issues are. And I really liked, I think it was you, Perdy, that talked about using your inspections to do qualitative interviews rather than just going around and looking at fire extinguishers. Not that that's not important, I don't mean that, but we did that in my workplace when I worked in the health service. We did a qualitative interview kind of inspection, and we went around and we just said to people, what's your work like? What are the issues? What are the problems that you're facing? And it was really helpful for us as reps to get that information. And I think it also started people talking. So yeah, keep your eyes open, and attending and befriending, I think, is going back to that. Just, you know, look out for people and you know, try to get a sense of what's going on.
A couple of other things could be to look at your institution's policies. Is there a domestic violence policy? I mean, we haven't really talked about that, but the TUC has some really interesting materials about how domestic violence has an impact in the workplace. Is there a menopause policy? Is there a stress policy?
Yeah.
When was the last time they carried out a stress risk assessment? And sometimes those things are done in ways that they don't quite sound like it. So they could be calling it a staff satisfaction survey or something. And sometimes management teams can sort of pass off that kind of thing as a stress risk assessment when it kind of isn't really. You know, look into the policies and stuff you can find on the human resources department of your company's website if you work for that kind of employer.
Thank you.
Actually, it's really important in casework, if you're a rep and you're actually representing somebody, that you look at whether or not the company has followed their own policy, because that can really trip them up. That sounds terrible, but you know,
not in a health and safety webinar, please.
No, okay. But if you're representing somebody and you know the employer is saying blah blah blah, and you say, well, what is the policy on this? And sometimes that's really important, just to know that or find out what the policy is, so you can then quote it back to them and say, well, actually, you know, and it might be like you say, a menopause policy or a alcohol and drugs policy, or you know, it could be all sorts of things.
Oh, and the sickness absence policy is obviously a key one. Yeah.
Thank you. That's really useful. Really useful. I asked for one, and I think we've got about 7 there, but I hope amongst those suggestions, everybody here has found one thing that they think they can go away and do. And I think for me, the key really is that whole thing about connecting, making those connections, just talking to other people at work, finding out what their daily life is like, what is causing them problems, and then finding that common thing that actually a lot of you are irritated about, or that thing that is making life difficult for everybody. And that's the thing that you start the fight on, or start the campaign on to improve. So I'm going to thank our fantastic panel. Honestly, it's been really fascinating. It's been a joy to chair, because you've been so disciplined, so well well organised, well informed, and you've thought through what you were saying really well, I think, in a way that made it really easy to listen to and to understand. And the responses to the questions as well have been brilliant. So thank you so much to Susan, to Perdy, and to Kathy. We will send out to everybody who registered for the webinar a link with all those, a document with all those links, and we will go away and we'll think about how we can take it forward as a network. But I think we've already got some ideas there about how we might actually start supporting you in taking up these issues, and how we might think about sort of bigger campaigns as well. So I would like to thank everybody who's come tonight. I know it's not easy after a day at work, and especially to our three speakers for giving up their time and for sharing their knowledge and experience with us. It's been a really, really brilliant webinar. Thank you so much.
Thank you
and we hope to see you all again soon.
Yeah, and thanks for coming, everyone. Brilliant.
Yes, thank you. And thanks for inviting me. Yeah.